Weight loss surgery isn't just about losing some pounds. It's about feeling better and living your best life. Dr. Galileo is here to show us how it all works, step by step.
My name is Dr. Galileo Villarreal. I'm a bariatric surgeon. I've been doing this for 13 years now. The first thing that the patient has to do is to fill out the questionnaire in the website. So I can take a look at the medical questionnaire, and that's when we know if we're going to have a patient that it can be a patient that can come here and have their studies done here, or if we do have to get pre-op study or evaluation in advance. For example, patients that have, just an example, patients that have a history of heart conditions, lung conditions, renal conditions, all that type of patient, I always ask for a pre-op evaluation from their doctor, so we know that the surgery can be made and that the surgery is gonna help them to overcome that condition that they have. Once that's done, the second step is to decide what surgery the patient wants. That's what we were talking about a little bit sooner, that it is a complex decision to make, but we take the best decision taking into account all the characteristics of every patient. After deciding what's the best procedure for them, we schedule their appointments with a nutritionist and with our psychologist. Our nutritionist has to give them a preoperative diet in order for the liver to shrink before coming here and get the surgery. That helps us a lot to have a safer surgery, a well-controlled surgery. It's not only the surgery, the patient has to do a lot of changes in their lifestyle. So we have to make sure that they know that in advance. But not only that they know that, but that they're willing to do it. That they are willing to do that change, so they know that there's going to be a change. We have to prepare them not only physically but also mentally. When they travel here, normally they come here one day before the surgery. That's when they come here to the hospital. We take x-rays, EKGs, blood work. If anything else needs to be done, it gets done. Our internist looks at the lab work, x-rays, EKG, looks at the patient, has an interview with the patient. Then when everything is ready, the next day is their surgery. Surgery varies time. It can be like 45 minutes for a sleeve, 1 hour and a half to 2 hours for a gastric bypass or a mini bypass. It depends on the patient. It depends on the condition. If it is a primary surgery or if it is a revision surgery, which takes a little bit more time because it's more work. After that, for a gastric sleeve, normally the patient stays here for 24 hours. And if the patient has no digestive symptoms like nausea, and if they're able to hold down liquids, we can discharge them for the most part the next day. Patients undergoing gastric bypass or mini gastric bypass, we for 2-night stay here. It is a surgery that is a little bit more invasive, and we like to have the patients a little bit more time here to be monitoring them that everything goes as planned.
MBS guiding you on your weight loss journey.